members, Budget 2023 is a $781.9 billion worth of development for the people of Guyana. And no amount of bad talk, no amount of cussing up the budget would change a single number in this budget. Mr. Speaker, I want to extend once again congratulations to Dr. Ashni Singh and his team at the Ministry of Finance for doing once again a fantastic job in crafting this budget, which is going to propel the Guyanese people forward. Mr. Speaker, we meet at a time when the world is recovering from the ravages of COVID-19 pandemic, when most national economies are in trouble, and when many multinational companies are retrenching people. We meet at a time when globally there's looming gloom, economic gloom. But amidst shrinking GDP globally, Guyana stands out as one of the fastest growing economies in the world. Mr. Speaker, by any standards, this would be a commendable achievement. Many reputable international institutions have commended the President and the government of Guyana for the stewardship of the economy and for the unfurling of the unprecedented transformational developmental agenda in energy, in food security, in job creation, and in improving dignity and well-being of all the people of Guyana. These investments are making a real difference in the lives and livelihoods of every single Guyanese. Mr. Speaker, hope has returned to Guyana. Optimism has returned to Guyana, and our citizens are excited about the future of Guyana. Mr. Speaker, while the whole country is excited, there are 31 lonely souls in the opposition that is desperately trying to hold back progress with their false narratives on discrimination and nepotism, and their objective is not about the people's welfare or well-being, but to sow doubts and fear and to derail the developmental agenda. Mr. Speaker, the Guyanese people are tired of these false prophets with their false narratives. They see through the bold attempt to rewrite history, but whitewashing the past cannot cover the incompetence and mismanagement of the PNC and the AFC. At the core, they are rotten, and they would remain, and those who remain with them, and those who associate with them, and those who listen to them will be devoured by them. This is not the Guyana we want. This is not the Guyana we deserve. We want a Guyana where everyone will work together to transform this country and where all of us can share and enjoy prosperity. And that prosperity is when we have one Guyana. Mr. Speaker, earlier today, we heard from two of the speakers on the opposition benches. We heard the Honorable Kamraj Ramjatan once again showing his scant regard for the sugar industry and the sugar workers. Mr. Speaker, I don't know what the sugar workers would have done to this honorable member, because in almost every budget speech, he would find a portion of that speech to ensure that he attacked sugar workers and their families. We just heard him this morning. What did he say? He said that the APNU meaning the PNC and the AFC, was very proud to right-size the sugar industry. What did he mean by that? He meant that they retrenched or fired 7,000 sugar workers, which meant if an average sugar worker family is about 4 persons in a family, 28,000 persons were left on the breadline. And that is the legacy that he is proud of. That is the legacy that he comes every time we have Parliament and talk about right-sizing the industry. And when we try our best to resuscitate the industry, to give people a livelihood, to bring back dignity to those families, every time he comes here and he would say that we are throwing good money after bad money. This is the honorable member who once, when they were campaigning before 2015, went out and told the sugar workers that they will increase their salary by 30%. And now, when they got into government, that is how they repaid the sugar workers. But it is not only that, Mr. Speaker. When you look at the years of APNU and how they devastated the sugar industry, in 2015, when we left government, the growth in that sector was 6.9%. In 2016, under the stewardship of APNU, it dropped to minus 20.6%. And then in 2017, it dropped further to minus 25.2%. And in 2018, it went to 23.8%, all minus growth. 2019, it was minus 11.8%. And then 2020, minus 3.7%. This is the legacy. This is how they have destroyed the sugar industry. And then he comes here and he said they don't have money. And they were working with a very small budget. But what small budget were they working with? When you look at the various funds that you had in the economy, the Forestry Commission Fund, what did they do with those monies? They raided the fund, spent all the money, and then when we got back, there was nothing there. What happened to the other funds like GPL? They spent all the money out, and again, now they're crying that during their time, they did not have money to spend on sugar workers and other sector of the economy. If we really look at what they did during that period, they would have spent close to $1 trillion. And what do they have to show for it? Absolutely nothing. Nothing. He came here this morning to tell us all of a sudden that the fisheries industry is on a decline. But if we go back to the stats and go back to the records, what do we find? In 2018, under the APNU, the fisheries industry declined by 8.4%. In 2019, it declined by a 0.7%. And then, well, that was a slight increase from where it was in 2018. But then, by 2020, it made a major dip to minus 17.1%. The decline of fisheries did not start with the PPP. The decline in fisheries started with the APNU and the AFC. And this is what we are working to correct. This is what we are doing. Then, the other member, who didn't want to say perhaps that he's APNU, he said he's GAP. And he had a lot of gaps in his presentation. One of the things that he said was that we must get our knees off the necks of the indigenous people. And one would think that during his tenure with the APNU, he would have been robustly defending indigenous people's rights in this country. But what he stood here today and did was to offer excuses upon excuses for the way that the APNU, the way that the PNC, the way that the AFC, the way that the GAP treated the indigenous people of this country. He came here to say that it is not the APNU who knocked off the CSOs, but he said that there was a letter from a PS on our side who fired these CSOs. But if he would go back and look at the records of this parliament, in 2015, the then Vice President, Sidney Allicock, came to this same National Assembly and said that he was the one who wanted a change in the program so that there will no longer be CSOs, but there will be another program called, I think it was called HAY or something like that. Youth Entrepreneurship Program. And he produced a letter to this National Assembly. And so, Mr. Speaker, I'll ask that that letter be recovered from the records of the Assembly and circulated here to the honorable members. But similarly, I would like to ask the honorable member, Mr. Henry, to bring the letter that said that a permanent secretary from the Ministry of Amerindian Affairs terminated those CSOs. We want to see that letter in this National Assembly, or he should withdraw it and apologize. Mr. Speaker, I want to go back, or I want to talk a little bit about the APNU's tenure in health. In 2015, Mr. Speaker, we saw a litany of promises that were made by the APNU and the AFC. And in 2015, 2016, 2017, 2018, 2019, and up to 2020, there were a number of budgets that were presented. And in each of those budgets, the then Minister of Finance made statements about what would be done in the health sector. And I want to recap some of those things. And I want to say, and I want to ask the honorable members over there, where are these programs? So let's go through them. In 2015, one of the things that they promised was that they would set up a pediatric cardiac program at the Georgetown Hospital. And I want to ask, where is that program? It was there in 2015. Up to now, nothing could be produced by the APNU and AFC. We, Mr. Speaker, we have started putting back a program that we had before, which they dismantled. We used to do pediatric cardiac surgeries in this country, and they dismantled it. And now we have to rebuild it. And that's what we're doing. In 2016, Mr. Speaker, they promised us that they would bring a commission of inquiry to study suicide prevention. Well, 2016 came and went, and nothing was delivered. No suicide commission, another broken promise, another promise that went unfulfilled. In 2016, in the budget, they said they would have spent 1.9 billion Guyana dollars for the construction of a state-of-the-art specialty hospital at Liliandal. This was a PPP project that we started, and shortly after they put it in the budget, by the next year, they cancel it out of the budget. No more specialty hospital. Mr. Speaker, in 2016, they also put in their budget that they will build a 10-bed cardiac theater, whatever that means. This was another broken promise, because after their tenure, there's no 10-bed theater at the Georgetown Hospital. Mr. Speaker, they also promised to have a new lab at the Food and Drug Administration, and they budgeted $110 million for the establishment of that lab. But here again, monies were spent, no lab is in existence. No promise. This was another promise that they couldn't deliver on. In 2017, they promised a mental health institute. Where is the mental health institute? Again, another broken promise. In 2018, they told the people of the East Coast they are going to rehabilitate the C.C. Nicholson Hospital. Where is the rehabilitation? Nothing was done. Another broken promise. In 2019, they promised the construction of a new accident and emergency at the Georgetown Public Hospital. Where is the new accident and emergency? Another broken promise. Nothing was delivered. In 2019 again, in the budget, they promised that they're going to deliver a state-of-the-art trauma center. Where is this trauma center? And again, another broken promise, and nothing was delivered. This, Mr. Speaker, is their legacy. This, Mr. Speaker, is a lot of promises, but absolutely no delivery. This is what incompetence and mismanagement looks like.
Look at it. Behold, incompetence.
That is why, Mr. Speaker, they are on that side of the House. Mr. Speaker, when you couple this litany of failures with the massive drug shortages that they had in the system, with the Sussex Street drug bond scandal, with the procurement scandals, with what happened at Ocean View, the fiasco over there, with how they shut down the National Ophthalmology Center, how they had no audited accounts at the Georgetown Public Hospital for 5 years. This, Mr. Speaker, is mismanagement, and this is the legacy of the PNC, AFC, and all of them who call themselves APNU. This is what they want us to forget. But we will not forget this sorry past. But our task today is not only to fix what they have left, this broken system, but we are going to fix it and transform it into a world-class healthcare system. Mr. Speaker, fixing the primary healthcare system. Between 2021 and 2022, we have upgraded more than 250 health centers and health posts in every single region of Guyana. We have collaborated with the Pan American Health Organization and develop a comprehensive package of services where we will be able to deliver more than 216 interventions at health centers and health posts across this country.
Powerful. Powerful.
Mr. Speaker, among these interventions would be maternal and child health care, would be working to put better diagnosis for infectious diseases,
Listen and learn.
to also put better diagnosis for chronic non-communicable diseases, to provide immunization for our children across this country, and to make sure that we can also provide eye screening, dental checkups, and screening for hearing impairments. Mr. Speaker, for eye screening, just last year, we started the distribution of 4,500 spectacles to communities in the hinterland. And just to put it in perspective, a spectacle will probably cost between 20 to 30,000 Guyana dollars. We are giving them away for free in the hinterland of Guyana. And as if that is not enough, Mr. Speaker, we have sent our ophthalmologists into the regions where we are screening people who would have eye problems, such as cataract, and we make a short list and we bring them out to the Port Morant Hospital, the same one that was neglected by the APNU, and we are doing cataract surgery for those patients. Right now, hundreds of patients have already benefited from that service, and now people are quite satisfied with the kind of eye care they are getting from the Ministry of Health. Mr. Speaker, up to last year, if you had to get a hearing aid, it would have cost a patient 65,000 Guyana dollars for a hearing aid. We were able to screen more than 500 persons across this country, and we give them hearing aid free of cost. And in this budget, we would be providing another 1,000 hearing aids for persons who need such service. Mr. Speaker, to deliver the services at our health posts and health centers, because under the APNU, not much training was done for health personnel. And over the last 2 years alone, we have trained more than 200 community health workers. So much so that in every health center or health post in regions 9 and 1, there are at least 2 community health workers at each of those centers. This is what progress looks like. But not only that, we have given to these health centers rapid kits that can do all types of diagnoses. So we have moved from where we used to do microscopy for malaria to now where you can do rapid testing for malaria. And this type of testing is going to be rolled out at all such centers. And once we diagnose someone with whatever ailment they have, we have all the medicines to make sure that they are treated properly at the health center. In addition, Mr. Speaker, over the last 2 years, the Ministry of Health would have provided to the hinterland communities, to health centers and to hospitals, approximately 31 ATVs, 14 ambulances, 24 boats, and 9 motorcycles so that we can improve transportation of the medical personnel and moving of patients. This, Mr. Speaker, is what progress looks like. They had 5 years and they couldn't even deliver 5 ambulances. We were able to do 14 ambulances in just 2 years. Mr. Speaker, but all that I just spoke about was fixing the things that they broke. What we have been able to do, because as I said, we want to transform what we are doing from the rudimentary to a world-class system. And to do this, it requires innovation and it requires the application of technology. And with this in mind, the government of Guyana has started a remote e-medicine clinic at Napi, at Pariquaranao, at Yupukari, and at Guns. Now, what is this telemedicine? Telemedicine that we have put in there, we have a computer at each one of these sites, and in that computer we have an electronic health record system, and the computers are connected to the internet through satellite, and it also has internet-enabled devices, and it is powered by solar energy. Now let me give you an example of the capability of the system that we have just put in. Guns is probably about 500 miles away from Georgetown. What we can do when a patient goes to the community health worker at Guns, we are able now, first of all, talk to the community health worker, they put in their information. Having put in that information, if she cannot solve the problem, then she can dial up a doctor either at the Letham Hospital or dial up a doctor at the Georgetown Public Hospital. When that doctor come on screen in real time, if the doctor would like to examine the eye, you can have the camera look at the eye. If they want to examine the ears, we can do so, the mouth. Whatever it is, we can examine that. And if the doctor would like to hear the heartbeat of the patient that is located 500 miles away, then all you need to do is put the stethoscope and he would hear the heart song 500 miles away in Georgetown. And we would be able to make the diagnosis. If we need to do an ECG, we will be able to do that ECG from Guns and coordinated by the doctors at the Georgetown Hospital. If we need to do an ultrasound, the ultrasound probes that we have, we will be able, the community health worker would put the ultrasound probe over the abdomen of the patient, and the doctor at the Georgetown Hospital would be able to see the image in Georgetown. This, Mr. Speaker, is what progress looks like. This is what the new system that we are building. And we don't have it at one place. We have it right now as a pilot in 4 communities in Region 9. And the plan in this budget is that we'll be expanding that so that more and more people can benefit from such service. Mr. Speaker, what about district hospitals? One of the things that we noticed in a lot of our district hospitals was that many of them did not have surgical theaters. And because of that,
Honorable Minister, you'll need an extension to continue to conclude.
Mr. Speaker, I ask that the honourable member be given 5 minutes to
Thank you,
conclude his
Minister
presentation.
Etchell. Honorable Minister, yes, you may continue to conclude.
Thank you very much, Mr. Speaker. Mr. Speaker, we start fixing the district hospitals. We have added new theaters. Right now, there are about 8 new theaters that have been constructed in different parts of the country. But, Mr. Speaker, it's not only that. Last year, we started putting in X-rays. We have 13 new X-rays that would be installed between now and the next 6 months. They would all be installed, and all of them would be digital X-rays. In addition to that, Mr. Speaker, we would be building 6 new regional hospitals. And as you know, Mr. Speaker, one of the hospitals would be at Lima, one would be at Dikendren, one would be at Diamond, one would be at Enmore, one would be at Bath, one would be at number 75. And at each of these hospitals, they would have about 75 inpatient beds. We would also have modern theaters, new accident and emergency, new imaging suite, including in each one of them a CT scan so that we can do better imaging. In addition to this 6 hospitals, we'll be adding a 7th at Bartica, and already we have started the design for that hospital, and it would have similar amenities. Mr. Speaker, it's the project started. What do you want me to do? Don't talk about it? I am very proud of it. Yes, we got 7 hospitals now. And in addition to that, Mr. Speaker, we have the pediatric and maternal hospital, which I talked about last year too. That's 256 beds. And it's a top referral hospital when it would be concluded. Mr. Speaker, apart from these hospitals, we also would be introducing new types of services, including what we call telediagnostics or teleophthalmology, teleradiology, and telepathology. This would cause the turnaround time for samples sent to the labs to be much shorter. Our collaboration with Mount Sinai is going to see operational efficiency at the Georgetown Hospital improve drastically so that patients can have better comfort when they go there. Mr. Speaker, we are also working on our oncology suite, new cardiovascular services. We are also going to be introducing new guidelines for diabetes. In another month or so, you will see new national guidelines for diabetes. And by the way, Mr. Speaker, the Honorable Minister of Finance mentioned the first diabetic center. I can proudly say that that center is now operational at Lusignan. Mr. Speaker, we have many things to be proud of. We have seen, starting from this month, that we would be increasing the salaries for nurses, doctors, and every clinical person working in the health sector. A doctor who has graduated 3 years after graduation would now receive a salary of $450,000. A nurse midwife would now get 220,000 Ghana dollars. And guess what, Mr. Speaker? If you go to their manifesto, this manifesto here is what they said. They said APNU AFC commits to implementing the following recommendation. And the second recommendation, health services including the organized export of nurses. They want to export nurses. We are trying to train our nurses and retain them by paying them better. And that is what we'll start doing from this month. And by the way, Mr. Speaker, starting in the first quarter of this year, we'll be training 1,000 nurses for the health sector. Mr. Speaker, this is what, when we talk about progress and what we have been doing in the health sector, this is what we have been doing. And I don't have enough time to talk about all the other programs. But I just want to say, Mr. Speaker, that I want to thank the Honorable Finance Minister and commend this budget. Thank you so much.